Hello, I'm Bob Chaloner, the President and CEO of Southampton Hospital, and I'd like to welcome you to another edition of Focus on Southampton Hospital, your monthly television program about the people, the programs, and the events at your community hospital here in Southampton. Today we're going to do a program. When I first heard about it, I was really excited about it, and I've been eager for this filming because it'll be a very, very different program about a program that brings a lot of joy to my heart, certainly at Southampton Hospital, and I know to a lot of other people, and this is our pet therapy program. Pet therapy is something that many years ago we would never welcome dogs into a hospital. We would have been concerned about animals of any sort roaming through a hospital, and hospitals are changing. We recognize that it's more than just the technology, it's more than just the tile walls and the equipment. It's also about the environment we're providing and the opportunities for people to heal, and about mindfulness and some of the other benefits of the environment as well. So something we're very concerned about here at Southampton, and one of the programs that was introduced to us through a unique set of circumstances is our pet therapy program. And I'm going to welcome a special guest today. Her name is Susan Appell. Susan is the coordinator of our program, which we call Caring Canines Fetch a Smile Pet Therapy Program at Southampton Hospital. And before I introduce Susan, I just wanted to mention that the genesis of this program was an interesting story. I thought one of our former and very beloved board member, Stanley Friedman, was walking on a beach one day and ran into a woman with a very lovable dog, Jane Moss, and the dog's name is Dipsy. And Jane and Stanley started talking about how wonderful it would be if we could have dogs and come into the hospital and help in the healing process. And through that, we created this program, worked with a national organization that's been doing it at other hospitals. And thank you so much for being with us. And
my pleasure.
And tell me, first of all, just to get started, tell me a little bit about yourself and how you came to do this.
I got started really before I moved to Southampton. I lived in Houston, Texas, and my dog Lulu and I participated in a program there.
Right.
When I arrived here, there was no program. And thanks to Jane and you guys at the hospital, I heard about the program and became a volunteer. Okay. And that was at the very beginning, about 4 years ago when it first got started. And in the beginning, it was really Lulu and I, because Jane was back in the city in the winters.
That's right.
And then as time has gone on, I had the opportunity to become the coordinator of the program. And we now have over 20 dogs, some who vacation in Florida in the winter and are in the city in the winter. So we're always looking, for new dogs. But it's been really wonderful to be part of it.
I always smile when I hear about our dogs. We have dogs that are snowbirds, or I guess snow dogs, as well as some of our people here at the hospital.
Exactly.
And this is a program that's not unique to Southampton. I think we're the first one. We may be the first one on the east end of Long Island, certainly. But it's a program that is in place in other parts of the country as well.
Absolutely, and really over a 40-year period, there have been programs started all over the country, and now there's even been medical studies about benefits of having the intervention of an animal in a hospital. I was reading just recently about the percentages of pain reduction, of depression reduction, of people feeling more energetic, just from a small few minutes with an animal coming in. And of course, in some other places they have rabbits. They even have ponies, miniature ponies at children's hospitals and things like that. But for us, it's just the dogs, and it's really been quite amazing to see the impact, not only to patients, but to the staff. So often, a staff member will walk up and say, I just need a hug, and it's not me they hug the dogs.
I was going to say, it's something that certainly I know myself, healthcare can be and hospitals can be very stressful places to work.
Exactly.
And the smiles that we see, and with the not just the patients, as you say, but with our staff as well. I always insist that every dog has to come to my office, and I get to meet each one of them. I love that moment.
That's right.
And visitors. visitors too, I know, really
Absolutely,
appreciate
family.
seeing- yeah.
Sometimes, you know, we'll go into a room and the patient may be down at surgery, and the family that's sitting waiting can we see the dog? And they say,
Right.
of course, we see everybody. So I think it just brightens up the experience for people, takes them away from what they're thinking about and feeling, and it seems to be quite successful.
And I know as a special treat today, we're going to get to meet a few of our volunteers,
Yes.
our four-footed
Yep.
volunteers
Yes.
and their owners. But let's talk a little bit. Some people might have some concerns about animals in a hospital, and I know that there are certain characteristics that we look for in our pet therapy dogs. Can you talk a little bit about that? What are you looking for?
First of all, you know, everyone thinks their dog is the best. There's no
Right.
question about that. But
I know mine is.
yeah, exactly. But it takes a special dog really to navigate the complex environment of the hospital and also to enjoy the work. And I think that it's important when people think about, you know, wanting to do this volunteer job, that it's good for the human and it's good for the dog as well. And needless to say, they need to have good contact between each other. There are requirements, without a doubt. Our dogs are all registered through national organizations.
Okay.
We primarily have pet partners, but there are other organizations. They follow sort of the same criteria. And both the human takes a course, and once they complete that with pet partners, then the dogs are evaluated with their owner by a certified dog evaluator to make sure that they have the right behaviors and characteristics. Then we have other things at the hospital that we do to make sure that the environment is right and that the volunteer dog and owner feel comfortable by, shadowing other teams when they visit, giving lots of support that way. So, I think it has to be a good partnership.
All of the dogs I know that we have here seem just naturally open and friendly. Is that a characteristic you're looking for, actually?
They need to be open and friendly, but they need to also not jump up on people.
Right.
So general obedience training is what the dog needs. It's not any super specialized kind of thing,
Right.
but also the right temperament. Because being the mother of two dogs,
Right.
I have Lulu who does this work and loves it, but I have a younger dog who would not be the right personality.
Right.
So, you can't take it personally when sometimes it doesn't work out. Sometimes that happens.
And one of the concerns I frequently hear are, what about if the dog is shedding or allergies, things like that? How do we deal with those concerns?
We've never had a situation where it's become a problem.
Right.
Occasionally, and it's really quite rare that a patient will say, oh, I have an allergy.
Right.
And we just don't visit them.
Right.
Shedding, the dogs are brushed out really well or bathed before they come, and they're not up on the beds. So I think
Right.
that it's just not been a problem. The other thing is that most people, even if they don't like dogs, they'll say, oh,
Right.
I don't really like dogs.
Right.
And then we'll say, oh, well, then we won't visit. And they go, but no, you could stand over
Right.
there.
Right.
And they kind of enjoy the interaction of just, like, some people are so surprised to see a dog at the hospital, so they ask a lot of questions.
Right.
It's rare, from my experience of volunteering, that anyone ever talks about their illness. They want to hear more about the dog,
Right.
or who, is it fun to bring the dog and that kind of thing. So it really gets them away from why they're actually
Why
in the
they're here,
hospital.
certainly. That's a big part of sometimes pain and symptom management,
Exactly.
just getting people
Or they
thinking
start
about
to,
other things.
the
so.
people that do love dogs will start talking about, oh, my dog is waiting for me at home and I can't wait. And they show pictures of their dogs a lot of times, or sometimes they'll want to take pictures of your dog because they think it's fun that a dog came to visit.
It is. It's
Yeah,
wonderful. And
yeah.
I know, again, like I said, with the staff as well, I think it's such a surprise. And when we have new employees, suddenly they see a dog. You
Yeah,
just see people lighting up.
exactly.
What about, let's talk a little bit about that training. What sort of training do the handlers have to go through? Do the
Well, I
owners
think
go
that
through?
you have to have really good control of your
Right,
dog,
okay.
or you know, simple obedience, sit, stay, down. Also, when we do the training with the dogs, the testing, you know, there's wheelchairs involved, there's IV poles that come around the dog. Right. The dogs are handled a lot because you really need to make sure that they're comfortable with things that can happen. In a hospital, you hear the binging and the bonging and, you know, right. IV poles and beds going up and down and sometimes, you know, intercoms. So the dog needs to be comfortable and not react to all that sound in a, you know, to bark or
right.
just
be able to handle
adaptable
and handle some surprises because you never know who's going to race around the corner if there's an emergency or something.
Exactly.
Do you visit all parts of the hospital?
No, we just visit the general patient rooms, but of course being very cognizant of rooms that are safe to go into. If someone is in what's called an infection control room, right. we don't go in those rooms at all, but we just see a variety, any kind of patient, but we don't really know the illnesses or anything like that. It's not important to us when we visit. It's just visiting.
What's been the reaction of the volunteers, I guess dogs and the handlers as well? I'm surprised that we're up to, you said 20 at this point?
Right. So. Now, of course, we only have one visit a day, right. And of course some of our dogs go away but you know, we've had a nice group that have stuck with us all right. along and seem to really enjoy right. getting to do it. We've expanded, we visit 7 days a week now if we have 7 dogs that want to come. Right. We also visit, you know, the weekends, which in the beginning it was slow, you know, until we had everything organized. And we also visit now early evening, okay. Because the thought was that often people feel very lonely right. in the evening. So 6 o'clock, 6-ish, and also for volunteers that works well for them.
That's great.
And that's been a successful thing. The staff in the evening also really love the fact that the dog.
Do you find it helps with loneliness? Sometimes people do feel lonely. They're not at home. They're away from their loved ones. Oh, I think so. Patients express that to me all the time, right. and they get to talk about, oh, I'm going to go home maybe tomorrow, and I know my dog is going to be waiting for me. So I think it does. Yeah. I know that somebody asked me a question. I'm surprised the regulators would approve this. Healthcare is so regulated, but we've had Joint Commission and all the regulators that have been here have been thrilled to hear we're doing this program.
Yeah, I don't think there's ever been a case where anything's been transmitted between right. animals and people or anything, right. you know? So,
exactly. Let's talk about pain management. Have you seen yourself some incidences where it seems like it helps somebody who may be in pain or struggling or?
Well, you may go into a room and see someone look very unhappy, right. and you know whether, I mean, I personally don't like to ask someone if they're in pain, but all of a sudden they sort of will perk up right. and they will start to talk, and you see a real change in their face. And it was interesting, one day I was visiting up where physical therapy is, just to do something up there, and one of the therapists said that we're working with a patient in a room, and a dog visit came in, it wasn't me, and the patient was very animated, really enjoyed the visit, and then did what the therapist wanted them to do, which really? They didn't. So I said, well, we need to do that more. But I think it's sort of invigorating for people, you know?
Yeah, no, I think so, definitely. I know one of the times, you know, people unfortunately at end of life pass away often in hospitals, and I know we visited some people that have been end of life also. It's been something requested, and how's that been?
Well, I know personally, I was asked to go visit a family and a patient that was at end of life, and they said, you know, she really loved dogs. She was not opening her eyes. She was really, you know, resting. And they took her hand and said, oh, Lulu came to visit you. She opened her eyes, wow. and there were probably 6 of her family member, her children around, wow. and they were just delighted wow. that she, you know, that was one of those little moments that you think, wow, that was so nice that I was able to be there, and they loved the fact that the dog came in. So Yeah.
That's amazing.
Yeah,
That's
no, and they were
amazing.
saying, this is like Bobo, or I forget the
Right,
dog they were talking
exactly.
about. But this is the dog, like, you know, and it was very, very
Must have been
special.
wonderful for the family members also.
They
to
were
just to
so
see that.
excited. They really were. So, you know, it is exciting when.
What about children, if there are any children in the
We
hospital? Do we ever
definitely
visit?
try.
Okay,
You know,
yeah.
often I'll get a call maybe that there's a child, or I'll talk to,
Right.
you know, the nursing staff, and they'll say there's a child. It's not that often, but they love to see the dogs. And
Oh, that's great.
Yeah.
Do we visit the waiting rooms, waiting areas
We
also?
do.
If
We
we
try
see
to-
somebody,
we
sometimes people are sitting there nervously,
Exactly.
waiting for
The little
family.
chapel area, we'll
Right.
try and stop in there. When we walk in the front door, there's
Right.
always people waiting there, and
Greeting
sometimes
us.
it takes 15 minutes to even get up to 2 or 3, because you're stopping and talking to people, and they're just petting the dog, and it's really nice.
And now we're going to have the best part of the show, which is welcome in some of our volunteers and
Great.
let them let people watching get a chance to see some of our canine
Absolutely.
goodwill ambassadors. But just
Exactly.
quickly, if somebody would be interested in participating with their pet, what would be the process?
Well, they could call me
Okay.
at 631-377-9646.
Okay.
They can always call the hospital. We're part of palliative care,
Okay.
so they can make a call there. But you know, it's probably the best way to get the ball rolling, and then I can tell them, you know, the specifics on how to do
Excellent.
it.
And you're still looking for volunteers if somebody might be interested?
Always
Right.
looking for volunteers.
Okay.
Always.
Great, excellent. So I guess ask your dog if you've got permission, or if the dog wants to come, and bring your dog on in. So, all right. So
Sounds
now
good.
for the next part of our show, we're going to welcome a couple of our volunteers and their canine goodwill ambassadors. And I think the first one we will have up is Gene Siller and Leo the Labradoodle will be joining us. Is that correct? Yes. Turn Leo.
Okay, Leo, sit. Here, first of all, heel. Come on.
Okay, as
And sit.
promised, now we'll have a couple of our volunteers and their dogs will be with us. And I'm never sure who I should be referring to as the volunteer, the dog or the handler, the owner. But I guess you're a team. And Gene Siller, I'd like to thank you very much for being with us
Yeah,
today and
thank you.
bringing Leo. And
Thank you for
I'm admiring
inviting
his
me.
scarf, which says Dr. Leo. And could you tell people who are watching how you got involved and about this program, what your experience is?
How I got involved. After teaching special education for 30 years,
Wow.
I had this great desire to have a therapy dog that I
Right.
could bring back into the schools and
Wow.
do some volunteer work. So from the moment I retired, I trained Leo, who is now standing.
Yeah. Hey, Leo. Hey,
What's
boy.
on the floor? Hey, bud, sit. To prepare to be
Right.
a therapy dog. And on the same day, President Obama and the Pope were in New York City.
Right.
We took Leo in to be evaluated by Pet Partners in Manhattan,
Wow.
and he passed.
He passed. What was that like? What was the training like, or the program like? What were they looking for?
Disposition,
Okay.
his temperament, and obviously obedience during the testing.
Right.
And then they rate them according to whether they can be in a predictable or a complex environment,
Okay.
and how well we handle them as well.
Right.
So Leo's been in extensive training. As a matter of fact, he still goes. So, and that's it.
I'm very impressed, and he's
Thanks.
a wonderful dog. Can you tell us a little bit what's it been like for you at the hospital? Maybe an experience or two that you could share.
Sure. I've totally enjoyed it. We've had a really good experience.
How long have you been doing it?
It'll be 2 years this year.
2 years,
2
wow.
years in October, November. We've had many patients that have been memorable, but 2 in particular were both, at different times, were both involved in animal care. And Leo seems to sense, people that really like him.
Right.
And the minute he walked into that room, he just gravitated right towards them. And you could just see that they were both comforted by his presence,
Wow.
which was really kind of neat. And
Were these people that were dealing with pain or kind of scared to be in the hospital? Did it sense a real helpfulness?
both were elderly.
Right.
Both, I think, were not given very good diagnosis.
Oh,
And
boy.
I think that the dog was just comforting to them and a distraction too.
Right, absolutely.
So, but
wonderful.
yeah, it's been great. It really has been. Good experience, good program, good people. Love the staff.
Giving you what you wanted when you thought about having a therapy
Everything,
dog?
everything
great.
about it.
Oh,
Everything.
good.
Yeah.
Great. Well, I'm so happy that you could
Yeah,
bring Leo
thank
by.
you. Thank you.
And Leo has his little dog tag, or the dogs are issued an ID also here at the hospital,
yes,
right?
he has his Leo, the
Hospital
Doodle
ID.
Hospital. He sat up on the chair and had his picture taken. Was very cooperative.
He's a very cool cucumber down
Yeah,
there. So,
he's
great.
pretty good.
Great. Well, I know we're going to welcome someone else now,
Okay.
so thank you so
Thank you.
much, Gene,
Thank you.
for bringing Leo over to meet
Ready?
with us.
Let's go.
Great.
You sit.
All right.
Let's sit. Come on. Let's lie down. Come on. That's it.
Well,
No,
now I'd
over
like
here.
to welcome Zoe Kamitses, and am I pronouncing that correctly?
Kamitses.
Kamitses,
Yes,
right.
thank you.
And she has two canine volunteers with us here. We have Jack and Charlie Dickens. Is that correct? Jack
That's
and
right.
Charlie Dickens. Which one's which?
Well, Charlie Dickens is the standard poodle.
Oh, hey,
and he's in a
Charlie.
program at the Rogers Memorial Library called Come Read to Charlie Dickens
Oh,
this
really?
summer.
Yeah.
And Jack is a golden retriever.
Hey, Jack.
And Jack is the reason we got into this program.
Oh, really?
Because 2 years ago, I rescued Jack. His owner had committed suicide,
Oh,
and,
no.
and she died leaving 5 dogs.
Wow.
And my name to, would I please find homes for them?
Right. Oh,
So
boy.
I found homes for everyone, and Jack was with me.
Right.
And he was very bereft. His whole life had been, and his
Oh,
knee
boy,
was,
yeah.
he had a torn ACL.
How old is he?
He
when
was
that
7.
happened? Oh, boy.
And he's 9 now.
Okay.
No, sit down. It's okay. And so we entered him in the therapy dog class at ARF,
Yeah.
because I thought it'd be a great way for him to bond.
Okay.
And he did very, very well. And Dickens had done a lot of obedience classes at ARF.
You already had Dickens at that point?
Yeah,
Okay.
Dickens I've had for 6 years.
Wow.
And he was a rescue also.
Okay.
So Jack passed and Dickens passed, and we've been doing this. And it's been fascinating because they go one at a time, and the reaction to the different dogs is very intriguing. Dickens is sort of like a sitcom.
Okay.
People will talk about his hair.
Yeah, the hair
You
is
know, the hair,
crazy.
they'll say,
Yeah.
where did he get that hairdo?
Yeah.
And they take a look at Jack and they burst into tears.
Oh,
They tell
really?
me the first dog they've ever had, and
Yeah.
and what it was like when they had a golden retriever. And
Wow.
so one is all head and one is all heart.
Yeah.
And when I had Jack one day, a young doctor came and got me
Yeah.
and said, please come with me. There is a woman and she's dying and she
Right.
loves dogs.
Yeah.
So she had been very, very agitated. She was going through an end of life kind of moment of agitation.
Yeah.
And we went in and she immediately started laughing and started petting Jack, and her husband was there, and it was very tearful
It had to
and
be very
wonderful.
tearful. Yeah.
And it was that the fact that Jack could be that meaningful
Right.
at her life at that particular moment. She loved dogs.
Oh, boy.
And that's why the doctor came and found me.
Oh, nice.
And so Jack has this great sympathetic face.
Yeah, he sure does. He sure does.
You know, he has this, you could tell Jack anything.
How is the husband's reaction to that
Oh,
situation?
he
That must
had-
have been amazing for him as well.
He kept saying, because she said, please bring my dogs as
Yeah.
well. And he said, we're going to do that tomorrow.
Right.
And he was so thrilled that she got to see a dog.
Oh, wow.
And it
Right.
was very touching. It was very moving and very rewarding.
I love the hairdo. This one, it's an amazing story. So how long have you been doing this with us now at
Well,
this
I
point?
think we just qualified this year,
Oh, wow,
both
you did,
dogs.
okay.
Yes, because Jack had to go through a lot of coursework.
Right, okay.
But he had such a sweet temperament
Yeah.
and I thought it would be great in honor of his owner
And that's
to do this work.
That is so
Yeah.
special. Thank you so much
You're
for
very
bringing them
welcome.
here. And I noticed they have their IDs as well, and you're ready to roll. I didn't realize that ARF had a program for pet
Yes,
therapy
Matthew
dogs. Yeah.
Posnick, I'm on the board of ARF.
Okay.
And Matthew Posnick.
That's where I got my dog from. It's a wonderful
Yeah, it's a wonderful
organization. Yeah.
shelter, and Matt Posnick teaches
Yeah.
a course, so I entered Jack.
Yeah.
And Dickens had done so many obedience classes there that he kind of knew the routines, and he could obey pretty well, but he still had to go through a little basic,
basic
specialized training where they ran wheelchairs at him and walkers. They banged walkers. They dropped trays because you don't want a dog that's easily startled.
That's exactly right.
So that it knocks over some important piece of the medical.
A lot of equipment banging around in hospitals. What's the reaction of the staff been to your two pets here?
Oh, the staff just goes crazy.
Yeah.
I mean, especially Jack for some reason.
Yeah.
You know, the golden retriever has that effect on people.
Yeah.
They all love Charlie Dickens, though. Also, Dickens has a big fan club also. But for some reason, Jack immediately gets people down on their hands and knees.
There's definitely something about that big face of his also.
Sort of
really,
like having a
amazing.
cake buffalo.
Absolutely right. It sure is. You're good boys. Very good boys.
Yes.
Well, thank you so much for bringing both of them here.
Thanks for starting the program at the hospital.
Oh, we're thrilled.
People really enjoy it.
It really makes a difference. It just humanizes, animalizes the place, I guess would be the right way to put it. So great, guys.
Okay,
welcome.
guys.
Thank you. And we're going to invite another one of your friends up here.
Okay, guys.
And last but not least, I'd like to welcome Susan back up here with Lulu, one of our original volunteers. And I know you, Lulu. I've seen you around the hospital lots of times. So nice to see you again. And tell us a little bit about Lulu.
Well, Lulu is now a 12-year-old golden doodle, and
12, she still looks young.
she's doing pretty well on her anti-inflammatory, and even with her cataracts. But she just loves to be petted. So this is generally how she is. She'll come into a room, and people seem to really love her. And I call her Lou a lot, so everyone always thinks she's a male dog, and hence the pink leash. And I'll say, no, she's a girl, but we don't care, do we? No.
Her fur is beautiful, really golden color.
Yeah.
You know, a question that occurred to me, have you ever been asked by volunteers potentially, is there any risk to the dog of being in a hospital with a...
You know, people don't seem too concerned. I think if they were, they've done their research to make sure that nothing can happen. And occasionally they'll say, do you think I should wipe my dog's feet when we leave the hospital? You know, I always say, if it makes you feel better, then sure,
do it.
Do it. But, you know, it really doesn't seem to be a problem. And once
those of us that work here every day, we don't really worry
I mean,
about it.
we
take
Purell our
precautions,
hands in and out, and we
right.
offer Purell to the patients too. When after they're done. And the patients will often be a little annoyed and say, no, I love dogs and I'm not worried about that.
Right.
So it's not been really a problem.
Can you tell us about an experience Lulu's had that's really been an impression for you?
Well, one kind of naughty thing that happened was someone had put their lunch tray down on the floor, and she found the half of a tuna salad sandwich, which was probably not what she was supposed to do. But so you have to be aware, you know, dogs tend to look for little things on the floor, stuff like that. But no, I think her best experience is every time she comes.
Is it?
Just all the pets and all the love, and she just seems to really. I'll say to her before we come, we're going to go to work today, and then I have a bag that I carry, and she knows when I get that bag, she goes to the door, and off we go. So she's usually pretty happy to be going.
It's so wonderful seeing. I don't want to go back to my office. I want to just hang out with the dogs all afternoon now. But I know that unfortunately our time is up, and I just, Susan, and hey, you want to say goodbye to everybody for me?
Thank you so much.
I was going to see if we get any of them to speak on command. That would be good, right?
No,
Actually do a final
we probably don't like them to bark.
Yeah,
that's
that's probably right.
Yeah.
I notice all the dogs that we have here are very, very quiet and calm.
No, we hope that they really don't bark. But
well, Susan, thank you so much for being with us today.
It's our pleasure.
And continuing to coordinate the program and bringing so many wonderful volunteers.
It's our pleasure.
So happy, and it really makes a difference for all of us here in the hospital. And I'd like to thank all of you who are watching today. If any of you have any questions about the program, our pet therapy program, would like more information, perhaps you yourself would like to volunteer, please give us a call. My number is always 631-726-8555, and we'd be happy to put you in touch with the right people. Also, if you need any help just navigating the healthcare scene out here on the east end of Long Island, we are here to help. As always, I'd like to thank our friends at CTV for producing this show and airing it in Southampton, and our friends at LTV for airing our show in our East Hampton communities. Please stay in touch, and we look forward to seeing you soon. Good health, everyone.